of the Republic of Ghana, Lordina Mahama.
Abusuomai Ghana ba pani a wodi kan wono a na ye Ghana mampani His Excellency John Dramani Mahama hokani oba pani maame Lordina Mahama na uhu no se wotena se na abusua Ghana AIDS Commission e abetu dwa se afi 2024 eba 2025 mu yi enipa 15,290 and omanya HIV aka eye figure dada e wo ho no ho enti sesie no make say oman Ghana mu nyina no enipa 334,721 and enya HIV e wo oman Ghana mu na san nipa yi no ema e wo mu eye 229,261 eye 68.5% of enipa dodo a ewo HIV no na emu 105,460 na ye emema eno nso 31.5% na abusua enipa afi 2024 mu enam HIV yade no so ewu ye eye 12,614 na abusua mienti hasen wei na yade a eye hu pa womu a enya HIV sesia no eye efri emfie dunum ekopim emfie aduonu enum 25 between 15 and 25 years enti no we no eye the youthful age for no enti se uko boyfriend ho na onim se boyfriend oye ma asem ne ade a ya hwi sanso na aye oba na ne ba bia wo kire ba ma bia na wa kire no na wawe na ya hwi ewo ho na nia esan ye hu ba ko pa ene se emantam num a HIV yade no apija no ho pa eye Greater Accra region na waba Central region, Eastern region, Ashanti region and Western region into wapue mantam wo Greater Accra region wo Central region and also Western region mo ena HIV yade no wo soro ho pa anti ya hweye e wo ho na esan sa niema a ekoso yi ama ehunahuna o my Ghana nti anam so ama Ghana ba pani Her Excellency Lordina Mahama ene Africa ha bibre mu ha sen first ladies akom ho abomu abehia amoma dwendwen kwan a yebetimi afa so na emma adimu akoten fi se wo hwe emma dodo a enya HIV na chese ma na HIV ade en edi omunya pa kwan be no mbefa so no matimi akọ saa yade boni sanso ena STIs nso no kwan on betimi afa so akọ saa yade boni anu nti ena nam so ama wa hosti omu nyina wo my Ghana mu ha na wo madwendwen ho wone nananom ahemafo eni mpanifo eka bi ewo mu a wo betimi ne mba ne Ghanafo embabu akasa ena oni omu ehia ewo atran kese mabusua ha Ghana News TV eso no anigu a ohwe no medin ene nana sefa hwene bobo mesro se ne ndi dikan aba ohwe me a na wa subscribe no wa share e de ama mesanso ena mesro se minua sandraku ejewa akoni nkrachi ne ena na wasanke di ne na otwenso abusua pani atwe na otwe da no asensen ho kakranti the latest update no ba batumanim but mesro se oya ukuru ye de sika enemia enti bomodia na contribution kakra do beboa me send fa 0246 075939 0246 075939 edin e woso MT mobile money name Samosefa nefa somasene ni entimi enhwe ne enkra menua baye chikra abusua sanso na mesre se wo amano na wo send diska bo my Ghana mu download lemfiles si a no mo cheska sika bia wo befa lemfiles so send aba wa bro mo ma correct rate na beto nipa no mobile money account mu na send bank account mu instant no almost sign 1% of scanner wo send by entebusua fa sa kwanya so na enjoy sa promotion abusua me enkwe ayenti enhwe ekwan a Ghana mampani ehokani Maami Lordina Mahama ene abibre mu aman mu ha ema pani edikan omka omotigbo mu no nya omoye e de aboa amietimi asosa yade kodie wei ano
Liberia and Kenya, and my dear sister, former First Lady of South Africa, you are all welcome to Ghana. Distinguished representative of the First Lady of Nigeria, Honorable Ministers of State, the Executive Director of UNAIDS, President of the Elizabeth Glaser, President of the Society for AIDS in Africa, Assemblies of God Women's Group, Executive Secretary of OAFLAD, members of the diplomatic corps, civil society organization, Nananom, chiefs and queen mothers, members of the media, distinguished ladies and gentlemen. It is both an honor and a privilege to welcome you all to the First Lady's high-level side meeting on ending AIDS in children and mothers by 2030. My husband, the President of Ghana, John Dramani Mahama, and the wonderful people of Ghana are honored to host this year's ICASA, which has provided us with a platform to continue shaping Africa's health and development. This presents an opportunity for us to confirm our shared commitment to one of the most pressing health priorities affecting our continent, safeguarding the health and dignity of mothers and children across Africa. Your Excellencies, the power of this conference lies not in our title, but in our shared determination to translate our advocacy into action. As First Ladies, we carry a responsibility to elevate the voices of those who are too often unheard. The mothers in remote villages, the newborns who are vulnerable to preventable infections, and the communities striving for healthier lives. Despite notable progress in recent years, the numbers remain worrying. Thousands of African children continue to acquire HIV, syphilis, and hepatitis B during pregnancy, childbirth, and breastfeeding. These infections can be prevented with timely interventions. Too many women still lack access to quality antenatal care, early testing, and life-saving treatment. According to UNICEF and WHO, mother-to-child transmission rate can be reduced to below 5%. However, it requires a combination of political will, sufficient resources, and community participation. It is therefore my view that this is not just a health challenge, it is a text of our collective commitment. Distinguished guests, through the Organization of African First Ladies for Development, we have established a strong movement of compassion and advocacy. Our united voice as First Ladies has highlighted the urgency of maternal and child health on the health agenda in our respective countries. It has mobilized resources, strengthened political commitment, and advocated for community-based solutions. This platform shows that when we unite, our advocacy crosses borders and changes lives. In Ghana, we have worked towards the goal of universal access to maternal and child health services. My office, in partnership with the Ghana AIDS Commission, has carried out extensive community medical outreach program in Accra and other regions of the country. Through these initiatives, women, young people, and families have received free screening for HIV and other conditions, comprehensive counseling, and direct access to quality care. President Mahama also established the Ghana Medical Trust Fund, known as the Mahama Cares Initiative. This program will expand access to healthcare by addressing both chronic and non-communicable diseases, recognizing that health issues often overlap and demand coordinated responses. These efforts demonstrate our strong conviction that quality primary health care is not a privilege for few, but a basic right for all. Your Excellencies, we look forward to hearing about your experiences and interventions in your respective countries. However, allow me to say that achieving the triple elimination agenda, which is elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B, demands more than clinical interventions. It requires, one, consistent and sustained financing to strengthen fragile health systems, effective community engagement that reaches the last mother and child in even the smallest rural village, a brave attempt to fight stigma that stops women from seeking care, empowering women and girls to make informed decisions about their health and futures, integrated service delivery that addresses the interconnected needs of mothers and children, and a strong political leadership that prioritizes maternal and child health in national development. Ladies and gentlemen, no child should be born carrying an infection that could have been prevented. No mother should be deprived of the services and dignity that safeguard her health and ensure her baby's future. These are not just aspirations. They must be our firm commitment. This meeting provides us with a precious chance to exchange experiences, build stronger partnerships, renew our commitment, and outline a clearer path towards 2030. The road ahead requires honest dialogue about what is working, sincere recognition of ongoing barriers, and bold action to bridge the gap between policy and practice. I commend OAFLAD, the Society for AIDS in Africa, UNAIDS, and all our development and civil society partners for their firm leadership and technical support. The knowledge, commitment, and action plans arising from today's discussion will influence the health outcome of millions of African mothers and children. Let us leave Accra united in purpose and confident in action. Let us ensure that our advocacy results in accessible clinics, affordable medicines, trained health workers, and empowered communities. We must work towards a continent where every pregnancy is safe, every birth is celebrated without fear, and every child begins life with the promise of health and opportunity. Ladies and gentlemen, to borrow from my husband's campaign message, we must build Africa where no mother is left behind and no child remains vulnerable. Thank you, Your Excellency, for your leadership and dedication and for joining us here in Accra. Merci. Thank you very much.
So we send this cafe amanoni aba Africa ha usulem fi say ye fia wo pese wo nto no usulem fi edan ya na say japade a wani da so a wo pese wo to Africa ha no usulem fi so we send this sika ama odofo e de aboa no wo Africa ha usulem fi sanso e na say uti obi school fees ama no a usulem fi nyenti amekanfo lem fi ama one say utimi send this sika e fa lem fi so a e ma ne begu bank account mu sanso e na timi begu mobile money account mu eno achi nso no de bia lemfi e wo daily rate a e ma hu sika dodo a wo sende a wo benya lemfi e secured na wo sende sika enche na nipa a wo sende ama no ne nsa aka lemfi wo USA, Canada, UK, Italy, Germany, Ireland, Netherlands, Spain, Belgium, Portugal and France. What the lemfi sende sika untu ahwe bomodi a dey use me code NEWS news na say ene any day di kan a register or lemfi so a unya bonus sanso e na use chen so a ye wo bonuses ahodo a ye de ma
Her Excellency, Madam Lordina Mahama, First Lady of the Republic of Ghana, and our dear host, let me start by thanking you very much for convening First Ladies into Ghana for us to have a conversation. My dear sisters, First Ladies of Africa, the First Lady of the Republic of Gambia, the First Lady of the Republic of Liberia, and the First Lady of the Republic of Kenya, the former First Lady of South Africa, Madam Tobeka, Madiba, Zuma, ministers here present, members of parliament here present, ambassadors and members of the diplomatic corps. More babies are being tested early and more families are accessing life-saving treatments. Mobilizing communities. Our voices reach places where policies alone cannot reach. In villages, chiefdoms, churches, mosques, youth groups, and women's circle, we have broken silence, shattered stigma, and replaced fear with hope. In Sierra Leone, I have seen mothers walk proudly into clinic because they now understand that testing is a shield, not a shame. Forging partnership that save lives. Working with African Union, UNAIDS, WHO, UNICEF, and civil society, we have strengthened health systems, supported national campaigns, and expanded integrated services. Partnership is our power, and through it, Africa has moved closer to the dream of triple elimination. Our journey has taught us profound truth. Political commitment means nothing without sustained investment. Integrated service gives mothers dignity, one door, one journey, one continuum of care. Stigma is a silent killer, one we must defeat through relentless community engagement. And above all, women must be heard because their life experience are our compass. These lessons tells us one thing: progress is not accidental, but progress is intentional. As we advocate towards 2030, OAFLAD stands ready to lead with renewed courage, guided by our strategic framework 2025 to 2030. Our priorities are clear and ambitious: championing universal access to high quality PMTCT and triple elimination services, advocating for full integration of HIV, syphilis, and hepatitis B services in maternal and primary health care, empowering communities to eradicate stigma and ensuring no woman, young or old, urban or rural, is left behind, driving sustainable domestic financing so that our progress become permanent, accelerating life-saving innovations in early testing, treatments, and vaccines. Our call to action are as follows. Excellencies, distinguished guests. The goal of ending AIDS in children and mother by 2030 is not beyond our reach. Africa has everything it needs: the leadership, the wisdom, and the unbreakable spirit of its people. We remain in our sheer resolve as president of OAFLAD and as the UNAIDS champion for adolescent girls and young women. I reaffirm our commitment to every girl who dreams, to every mother who hopes, to every child who deserves a healthy start in life. I pledge that our girls will not be forgotten. As an African woman, I pledge that I will continue to fight until every child is born healthy and every mother thrives. Let us rise together with courage in our hearts and determination in our actions to build an Africa where every child is born healthy and every mother thrives. At this juncture, permit me to say thank you to Madam Winnie for your endless championship in making sure our young girls in our continent understand what it means to be a woman and the job that we have to do just to survive. You have been the face of UNAIDS, and you have transcended and break boundaries for women to see. I want to thank you and also thank our executive secretary, Dr. Nadas, who, in her own wisdom, is able to put African first ladies together. Not because we're difficult, it's just that we're very hard to reach.
Thus, distinguished development partners, leaders of civil society here present, beloved sons and daughters of this beautiful continent, Africa, I bring warm greetings from the people of Liberia, the first birthplace of Pan-Africanism, Africa's oldest republic, which fought for a century for the dignity of Black people on the continent and around the world. And I also bring you special greetings from my beloved husband of 53 years of marriage, His Excellency Joseph Zuma Boakai Sr., a man who firmly believes that the greatest of a nation is measured not by its height or its building, but the health of its mothers and the hope of its children. Today, we stand in Accra, the second birthplace of Pan-Africanism, the land of Nkrumah. We gather not to speak about Africa's future, but to fight for it. And so I say with conviction, if Africa could fight for liberation together, Africa can fight for healthy mothers together. If Africa could unite for independence, Africa can unite for an AIDS-free generation. This I believe. This I believe transcends a ceremonial gathering, and this is definitely not a diplomatic routine. This is a summons to our moral responsibility, a call to protect the wombs that carry our future, the mothers who anchor our nations, and the children who represent Africa's tomorrow. May I re-echo this for swift action and be very clear. Like I always say at our other gatherings, we are not here for ceremonial speeches or diplomatic courtesies. We are here to affirm our collective commitment to speak with one voice and act with one purpose, that no child should be born with HIV. No child, I repeat, should be born with HIV. That no mother should pass on syphilis unknowingly. That no baby should battle hepatitis B from birth. Not in Ghana, not in Liberia, not anywhere in Africa. Let me be clear. Mother-to-child transmission of HIV, syphilis, and hepatitis B is evidently not a medical issue alone. It is a justice issue. It is a human rights issue. It is a development issue. And it is definitely a Pan-African survival issue. And today, we boldly declare that one African child should enter this world already fighting for life. I say to you without a shadow of doubt, not one African mother should be betrayed by a system that was supposed to protect her. Not one baby should carry a burden that already has been defeated. I want you to imagine and reflect on this for a moment. During one of my recent hospital visits, a 7-year-old boy tugged on my dress. He looked up at me with innocent eyes and said, "Grandma, when will my little sister stop being sick?" His mother stood beside me, tears rolling down her cheeks. She whispered, "She was born with what I did not know I carried, HIV." My dear sisters, this is why we must act with urgency. A child should never carry the burden of a system's silence. A mother should never carry the guilt of a system's failure. This is why, through my advocacy in Liberia, we have aligned our national priorities with the triple elimination goals. We are, one, expanding PMTCT services to hard to reach regions, increasing antenatal testing, counseling, and follow-up, strengthening supply chains to prevent stockouts, training more midwives, nurses, and community health workers, mobilizing traditional and faith leaders to change harmful narratives, and engaging youth and civil society to break stigma, silence, and shame. Our commitment is uncompromising, but we know we cannot do it alone. No country can, and that is why OAFLAD's leadership is vital, uniting us beyond our borders, beyond our politics, and beyond our limitations. My dear sisters, we need strong collaboration, sustained financing, and united continental leadership. Let us remind ourselves, beyond every stylistic is a mother with a heartbeat. Beyond every percentage is a child with potential. When a mother buries a child, she buries a piece of our nation. When a child is infected at birth, a continent's future is compromised. May I submit to you, all of us, that in Africa, a mother's cry is never hers alone. It is a summons to the entire village. Allowed me to draw from the fountain of our continental wisdom. An African proud poetry says, and I quote, when the roots are diseased, the branches cannot flourish, end quote. If we do not protect the health of women and children, we cannot expect the prosperity of nations. Let us declare wholly and without apology, the womb must never be a war zone. The birth of a child must never be a death sentence. And again, we cannot eliminate poverty if we fail to eliminate the disease that deepens it. And to my fellow first ladies, women with influence, compassion, and courage, this is our reality. If we cannot carry the scalpel, let us carry the story. If we cannot hold the microscope, let us hold the microphone. Our voices must disturb complacency and awaken accountability. I repeat, our voices must disturb complacency and awaken accountability. History has shown that when African first ladies speak, nations listen. When African first ladies advocate, systems shift. When African first ladies unite, the world pays attention. May I remind the queens in this room, our platforms are not ceremonial, they are catalytic. Our influence is not symbolic, it is substantive. Our voices are not decorative, they are decisive. We are the mothers of this nation or our nations. And mothers do not negotiate when it comes to the safety of their children. I repeat, mothers do not negotiate or should not negotiate when it comes to the safety of their children. Let this moment in Accra echo across Africa. Let it be written in a record of ICASA 2025 that the daughters of Africa stood together and declared, enough is enough. By 2030, Africa will deliver an AIDS-free generation, not by chance, but by choice. Not by hope, but by action. Because when Africa decides, Africa delivers. Let me remind us of the powerful words of Nelson Mandela, who said, and I quote, "It always seems impossible until it is done," end quote. Any mother-to-child transition may seem difficult, but so did freedom, so did independence, so did democracy, and yet Africa accomplished them all. My sisters, my colleagues, my partners, I am hopeful that we stand at a defining moment in history. Let us leave this place not as participants of a conference, but as guardians of a promise that every child born in Africa will begin life healthy, whole, and free. A promise that no mother's joy will be replaced by grief because of diseases we already know how to prevent. And so I close with this declaration, a declaration worthy of our mothers, our daughters, and the Africa we are determined to build. Let it be recorded that when the future asks who protected Africa's children, history will answer, it was the mothers of Africa, the first ladies who stood together, rose together, fought together, and delivered a generation born free, living free, and rising free. Africa's children are not stylistic. They are the future we refuse to fear. May God bless our efforts. May God bless Africa's mothers. May God bless Africa's children. And may God bless this beautiful and beloved continent together, today, tomorrow, and for generations to come. I thank you.
So we send this Fiamanoni aba Africa ha, Usulemfi. Say ye fear wo pese wo ntono, Usulemfi. E dan ya na se japade a wani da so a pese oto Africa ha no, Usulemfi. So we send this sika ama odofo e de aboa no Africa ha, Usulemfi. Sanso e na se uti obi school fees ama no a, Usulemfi. Yenti a make kamfo lemfi ama one say, utimi send this sika e fa lemfi so a e mani begu bank account mu. Sanso e na timi begu mobile money account mu. Eno achi nso no de bia lemfi e wo daily rate a e ma hu sika dodo a wo send a wo benya lemfi e secured na wo send this car enche na nipa a wo send ama no ne nsaka lemfi wo USA, Canada, UK, Italy, Germany, Ireland, Netherlands, Spain, Belgium, Portugal and France. What the lemfi send this car untu ahwe bomodi a dey use me code NEWS news na say ene any day they can register or lemfi so a unya bonus sanso and how you use chance so a ye wo bonuses ahodo a ye de ma
menu makwekwe sa sempa kania semenam na meti asempa na mo amane a na ma no keka me anyambia what ANS Trading Agency Limited nka se wo ka se door to door for no de ani watwa esanse obie ne wa wo se wo ho sa door to door business nim wo nneoma wo UK a wo de ko Ghana ana se Germany a wo de ko Ghana 3 to 5 weeks e bekwa kodu nipa ne puno anu se try na de mo demonstration ko wo se adwuma de ewe mu ne se wo ho bo no e da from se boko ANS Trading Agency Limited e wo air freight special service and nneoma ne ye de befa play entintempa na akwa kodu obetima fa sa plan we ya so de nneoma free Ghana akwa UK ana Germany FGG dem which na also agina ye na men drop bomb ANS Trading Agency Limited pe and a 40 footer any 20 footer container ya for UK ediko Ghana ana Germany ediko Ghana omo manuoma ye mere import o export o dem there for you omo Ghana na money 0249 170 423 UK has over free 0790 802 7527 Germany so 09173 771 2733 Ubenya ANS Trading Agency Limited our West Croydon ANS Trading Agency Limited Quantum Brantem Wana Beboya Baso maybe next time in your fill up from the Barrow.